A nose job in plastic surgery is one of the most common procedures done worldwide. And if you are looking forward to a nose job, then I will tell you 5 important things that can make you prepare better for your journey and help you understand your results better. I am Dr. Shilpi Bhadani. I'm a plastic and aesthetic surgeon at SB Aesthetics, Gurugram, India. Before I start talking about the nose job, I would definitely like to thank you because a lot of my patients come up and tell me that they like the content on my channel and we want to keep it purely educative. And I'm really overwhelmed with the response that I get for my videos. We genuinely try to keep our efforts purely educational, and we are very happy to see that so many of you get help from my videos. Now, when I talk about rhinoplasty, the first important thing that I want to tell you is that consultation is very important. So generally, for our patients, we would want a minimum of 2 consults before their rhinoplasty. Now, why is it important? So when you consult with your surgeon, it's basically a two-way process. It's not only that the surgeon is telling you or you are telling the surgeon, it's really a two-way conversation where you tell the surgeon your expectations and the surgeon can tell you what is actually achievable. So a realistic expectation becomes the foundation of a better result in the future. So you have to understand the limitations, you have to understand what can be achieved, and this again has to be a two-way process. So it's a very impactful surgery. Rhinoplasty can also, sometimes people, they think that their identity has changed with the rhinoplasty. So obviously these things need to be understood before you go ahead and make your decision about the surgery. The second thing is that it's not just about the looks. A lot of patients, they come up to me for rhinoplasty for reasons different than bettering their looks. So it can improve your breathing, it can correct your deviated nasal septum. After the rhinoplasty, for conditions like these, the sleep becomes better, exercise tolerance becomes better. So when you're talking about a rhinoplasty, it's not only about the looks, but also about function, about breathing. And again, of course, when we are doing surgeries for deviated nasal septums or, a crooked nose, so definitely the looks do become better, but it's not only about looks that we do a rhinoplasty for. In the rhinoplasty surgery, it is a very customizable surgery. So it's not a cookie cutter approach that we do the same surgery in all the patients. So indications will be different, people will be different. The type of surgery that we do for each person will be different. In some of them, we take the costal cartilage. In some of them, we take the cartilage from only the nose. Somewhere we are reducing the alar, not reducing the alar. So it really depends on what is your requirement and how we can deliver the best results to you. So obviously, it is not a one-size-fits-all approach. And definitely, you are a very active participant in the decision-making process where we give you the realistic expectation that, yes, this can be achieved and what all would you like to change about your nose. And also, it is important that you should have the nose that suits you best. Many times, patients will come up to me with a picture of a celebrity or maybe a model or somebody they like that, they want to get the nose that they have. So obviously, it is, we can try that, but then it is not recommended that you try to have something exactly like the other person is having, or even if it is possible, then it is definitely recommended that you should have a nose that suits your face and your identity is not changed with a rhinoplasty. A very important thing you must understand in rhinoplasty is that things may look worse before they start looking good. So obviously, when you read or you watch videos about rhinoplasty and how you have to prepare better, so you will always hear that you have to wait for a year. So obviously, it is not that the complete all the results will come only after a year. No, it's not like that. You will see improvement very early on also after the rhinoplasty, but then it's like waxing and waning. Some days will be worse than the other. Some days you'll feel that the nose is swollen, the tip looks heavy. Then some days you'll feel that, okay, this looks better. So obviously this to and fro will continue for a few months before it starts to settle down. Nose is a sensitive area, and especially the tip, it takes time to settle. So obviously you need to have patience, and definitely patience is the key when you're looking at a stable result, a good result, and that timeline that we usually tell our patients is generally about a year. So about a year it takes to have stable results from a rhinoplasty. Now the fifth important point, which is very important, is follow-ups. You must follow up with your surgeon. A lot of times we see patients that once they think that things have settled down, they're lost to follow up. So when you come back, the surgeon can actually examine you whether you are progressing in the right direction as regards to your healing. Because many times, especially when I'm talking about noses with thick skin, many times we see that we have to inject maybe something to thin the nose a little more, or lasers to better your skin, or sometimes some patients also face acne issues after rhinoplasty. So obviously these things will only be possible to correct when you come and visit for a follow-up. So this is very important that you keep these 5 points that I have told you in mind to get the best out of your surgery. So if you found this video useful, do like and share. You can subscribe to the channel for more such informative videos. Thank you for watching.